Hello friends, let us learn about a new topic today let us learn about the continuation of dementia, differential diagnosis of dementia. So in the dementia we have learned about some of the differential diagnosis in our last classes. In this class I would like to discuss about some of the one of the differential diagnosis of dementia, which is Parkinson's disease dementia. And there is one more thing which is called as dementia with Lewy bodies. If you see, generally Lewy bodies are seen in Parkinsonism, not in dementia. But if there is dementia in Lewy bodies, then it is dementia with Lewy bodies, and if there is Parkinson's disease dementia. So both these look similar, but what is the difference? So let me first describe what is the difference, and then we will see what generally happens, right? In Parkinson's disease dementia, a person, male or female, they have Parkinson's disease. Once they have Parkinson's disease, they are treated with levodopa. So, if they are treated with levodopa, as the side effect of levodopa, you get dementia. So this is Parkinson's disease dementia, that is development of dementia in Parkinson's disease. In dementia with Lewy body syndrome, there is male or female with dementia first, and then the patient is treated with antipsychotics. For dementia, you give antipsychotics for psychological problems, right? Antipsychotics can be given. Once they are treated with antipsychotics, then he or she develops Parkinson's disease features. So that is the difference between dementia with Lewy bodies and Parkinson's disease dementia. So what are the main clinical features of dementia with Lewy bodies? In dementia with Lewy bodies, he has dementia and he has visual hallucinations. And then he will have Parkinsonism, all the features of Parkinsonism. And then he might have false, fluctuating alertness. These are seen. Here, in both these diseases, whenever there is a precipitant, like infection or new medicine or some systemic illness, in such situations they may develop delirium as the first manifestation. So this might occur. So and then after this delirium, they developed other systemic illness, right? These clinical features will persist for a longer period, and in dementia with Lewy body syndrome, there is relative preservation of memory when compared to Alzheimer's disease initially. Initially, there is relative preservation of memory, because in Alzheimer's there is fast deterioration of memory, severe visual and executive deficits also. But here there is relative. Let me write again so that you will understand. Now let us describe the differences between dementia with Lewy body and Alzheimer's disease. So if you see the memory is relatively preserved. It is lost. And then if you see visuospatial and difficulties in executing things, that is executive deficits, in these both, it is severe in Lewy body syndrome and it is mild to moderate in Alzheimer's disease. So these are the major differentiating features between dementia with Lewy bodies and Alzheimer's disease. In dementia with Lewy body syndrome, now what is the pathological features that you see? In dementia with Lewy body syndrome, you see Lewy bodies and also Lewy neurites. So what does the Lewy body contains? What is a Lewy body? So Lewy body is an intraneuronal cytoplasmic inclusion body So if this is the neuron, it is intraneuronal cytoplasmic inclusion body and it stains with periodic acid skiff and ubiquitin. What are these functions and everything we will learn in Parkinson's disease. But what is Lewy body is this one. Is an intranuclear inclusion body. So what is there in this inclusion? So there are straight neurofilaments. This straight neurofilaments, that is here, these are the straight neurofilaments and these are surrounded by epitopes, amorphous material, right? So straight neurofilaments surrounded by surrounded by amorphous material. So this is the amorphous material. This amorphous material has epitope. Right? So this is what is generally seen in Lewy bodies. Right? So these Lewy bodies are found in substantia nigra in Parkinson's disease with idiopathic Parkinson's disease. Sometimes this Lewy body disease can be called as diffuse Lewy body disease, or if they contain a large variant of amyloid plaques and also neurofibrillary tangles, then we can call it as Lewy body variant of Alzheimer's disease. So majorly there are two types of variants here. One is Lewy body variant of Alzheimer's disease. In this they have Lewy bodies which are less, and there are many amyloid plaques and neurofibrillary tangles. Then that is called as Lewy body variant of Alzheimer's disease. If they have only Lewy bodies, then it is called as diffuse Lewy body disease. If they have only Lewy bodies. So this is the major difference between it. This is Lewy body disease. So this is about the Lewy bodies and Parkinsonism. Treatment is symptomatic. If there is psychosis, you'll have to give antipsychotics, and if there is increased choline and acetylcholine, then you can give cholinesterase inhibitor. So depending upon the symptoms, you'll have to treat it. So this is about dementia with Lewy body and Parkinson's disease dementia. Thank you guys for watching my video, and in the next class I will discuss about the dementia causes, other causes. It's just naming the causes and explaining how that occurs. That is a short class, and this will and then the dementia topic will be completed. So thank you guys for watching my video. If you have any doubts in the lectures, please comment it in the comment section. If you feel something is inadequate, even then comment it in the comment section. Thank you guys for watching my lecture. Thank you.